Hi guys, so today we are going to talk about carpal tunnel. So first I am going to talk about the wrist, and you have to understand what we mean by flexor retinaculum, extensor retinaculum, and structures that are superficial and deep to the flexor retinaculum, structures that are superficial and deep to the extensor retinaculum. All right. So a retinaculum it's just a tissue, um, a fiber. It's gonna be a fiber, right? That is gonna be converting the concavity of the carpus, right, into a tunnel. So the carpus, the arrangement of these bones, they become concave anteriorly. So we're going to have a retinaculum, which is called a flexor retinaculum, that is going to convert the concavity into a tunnel, right? So you can appreciate that this is medial, this is lateral, right? The thumb is always lateral, right? In the anatomical position. So we are showing it at this position of the hand. So we can actually appreciate here that this is your flexor retinaculum. And this right here that is posterior to your carpal bones is going to be extensor retinaculum. Right. So let's start with the flexor retinaculum. So the flexor retinaculum medially is going to be attached to the pisiform and the hook of Hammett. Laterally is going to be attached to the trapezium. Remember, the trapezium is a bone that will articulate with the first metacarpal of your thumb. Right. And then as it attaches medially to the trapezium, it's going to have a superficial part and a deep part. So we are going to have a sort of like an individual soul canal right here, a tunnel per se, that is going to transmit um, the flexor carpi radialis tendon, the flexor carpi radialis tendon right here, and it will be accommodated in its own synovial sheath, right? Then proximally, it's going to reflect with the deep fascia of the skin, and then distally is going to be attached to the palmaris aponeurosis, right? So there are structures that are superficial to this flexor retinaculum, that are these structures. They are very important, right? So there must be four structures depending on where are we gonna cut. But since we are cutting here, there we cannot see all of the structures, but we can kindly appreciate that the most medial, moving from medial to lateral, the most medial, you're going to have your flexor carpi ulnaris, and then you're going to have your ulnar nerve, your ulnar artery. Right here, you're going to have your palmar cutaneous branch of your ulnar nerve, and then you have your palmaris longus tendon, right? That will be attaching to the flexor retinaculum and the palmar aponeurosis. And then here you're going to have your palmar cutaneous branch of the ulnar of the median nerve. So let's go again, medial to lateral. Here, flexor carpi radialis, flexor carpi ulnaris tendon, ulnar nerve, ulnar artery, palmar cutaneous branch of the ulnar nerve, palmaris longus tendon, the palmar cutaneous branch of the median nerve. Good. Let's now get into the deep. Into the deep. What are structures that are found in the deep? So you can kindly appreciate here that this you're going to have so some texts they can give you 2 rows, some they can give you 3 rows, right? But you're going to have the flexor digitorum superficialis tendon and flexor digitorum profundus tendon, right? Being in the same synovial fluid, or let me say synovial sheath, right? And then you're also going to have your flexor pollicis longus tendon. And between the flexor digitorum superficialis tendon and your flexor pollicis longus tendon, you're going to have a narrow portion. So you're going to have between your flexor pollicis longus tendon and your flexor digitorum superficialis tendon, you're going to have your median nerve. Compression of the median nerve deep to the flexor retinaculum will result into carpal tunnel syndrome. Right? Carpal tunnel syndrome. You should take note of that one. Right. So we also include the flexor carpi radialis tendon as a structure that is deep to the flexor retinaculum. Take note of it. Though it is in its separate compartment, it is also involved. Right. Let us get to the dorsal portion. Dorsal portion. So this is going to be your flexor, your extensor retinaculum. Your extensor retinaculum. Your extensor retinaculum is going to have structures that are superficial and structures that are deep. So let's start to the structures that are superficial. Right? So from medial to lateral, first you're going to have a nerve that is called the dorsal or the posterior cutaneous branch of the ulnar nerve. And then you're going to have your basilic vein, right? And then you're going to have your cephalic vein and your superficial branch of the radial nerve. The one that we said it is a content of your anatomical snuff box. Good. What about deep to the flexor retinaculum? To the extensor retinaculum, sorry. Right, so the extensor retinaculum, medially it attaches to the pisiform and the hook of Hammett, and then laterally is going to attach to the radius itself. And then these are the structures, right? You're going to have 1, 2, 3, 4, 5, 6 compartments, right? 6 compartments, 1, 2, 3, 4, 5, 6 compartments, right? So let's go. So from medial to lateral, you're going to have your extensor carpi ulnaris tendon in on synovial sheath, your extensor digiti minimi tendon in its own synovial sheath, and then you're going to have the extensor digitorum tendon together with the extensor indicis muscle being in the same synovial sheath. And then the extensor carpi radialis, longus, and brevis, they're going to be in the same synovial sheath. As for the extensor pollicis longus tendon, it's going to be in its own synovial sheath. And then you're going to have your the ones that we said will form the lateral border of the anatomical snuff box. That's your adductor pollicis longus and your extensor pollicis brevis. They will be sharing the same synovial sheath. Right. So these are the structures that form um, that have the relations to your flexor retinaculum and your extensor retinaculum. What is important is take a look at the carpal tunnel syndrome that we said that the median nerve, it will be between the flexor retinaculum, the flexor digitorum superficialis tendon and your flexor pollicis longus tendon. So if there is enlargement of any of the structures within this carpal tunnel, it will result in carpal tunnel syndrome. So thank you so much. That's all I have today.